Welcome to our YouTube channel of Trishla Foundation. As all of you will be knowing that we have started a special webinar, the person with cerebral palsy who now become adults. As you know that cerebral palsy is a lifelong process and it is going to affect every individual affected with cerebral palsy for whole life. So they are going to have some impact which can harm their body, they can have a lot of complication which can impair their quality of life and even the age of the life. So everyone should know what are the impact of aging and how they can prevent it. If that happen, how can they manage at home, and if they require any special care, how they can get that one. This webinar will be continued for nearly 1 year. In the start, I have taken one talk on the effect of aging on cerebral palsy individuals. And as you know, the brain lesion is static and change in disability pattern depend on many factors. The disability can be steady, decreasing, increasing. That happen because of how you take the treatments, what environment, and how you take the life. It is a lifelike conditions. And as you know, earlier we don't find any adult or old age people with cerebral palsy, but nowadays you can see in the society there's lots of person are surviving up to the adulthood, even up to the old age. This happened because of good medical facilities. So they are going to have some problem because of cerebral palsy as well as because of aging. Shorter lifespan in the cerebral palsy is not because of cerebral palsy. It can happen, but it will happen that will be because of some other causes like epilepsy, cardiorespiratory problem and feeding issues and uncontrolled epilepsy. As age, every person, the muscle becomes tighter as a process of the normal aging. But in the cerebral palsy, their muscle tightness will be much more than the normal individuals. And they use 3 to 5 times energy to complete everyday task which other person are doing in the normal phase. The most of the cerebral palsy individuals who now become adults are not prepared for the fact that they cannot longer easily do what they could do before. So they become afraid, they become worried, they develop some psychological problems and they require some care and extra support from other persons. These unexpected losses pose a new threat to their independence. Such people get very upset due to this fact. So it is very important for them to know how they can prevent it, if it happened, how they can manage it, and in reality what is going to happen on their bodies. And the cerebral palsy individuals have lots of other problems, just like the lower level of education in some persons, higher level of unemployment, less disposable income, self-care problem, lesser social activity, communication problem, and ultimately they can get social abuse, drug and alcohol abuse. They can create lots of problem in adulthood. And adulthood is the difficult and exhausting process for anyone. But in cerebral palsy, as you know, the symptom of cerebral palsy may present extra burden with early presentation. So they can have the more problem than the normal individuals. But even in the cerebral palsy individual, by maintaining the positive attitude and determination, the individual with cerebral palsy can enter the adulthood feeling excited for the journey ahead and they have a good quality of life. Now, I am coming to the topic, what is the aging? How we can say that, what is the impact of aging will be there? Aging is a consumption to the death progression of developmental changes. It is not simply process of becoming older, less functional and dying, but it is a component of growth, development, acquisition, maintenance of skill and functional capability throughout the life. Aging is not homogeneous process. It depends on many factors. It includes genetic makeup, how their family background is there, what was the genetic makeup is there, lifestyle choices regarding the eating habit, feeding, and what about the how they are active, and environmental exposure is very important. Stages of this aging, There can be early stage, middle age and older age. In the early age, they will achieve the increase in the skill and capability. In middle age, that means adulthood, they have to maintain the function. But in the older age groups, the function decline at whatever you do. Disease, disability, environment, trauma can affect individual with cerebral palsy at any stage. So, stage of aging now come that it is self-sufficiency. They live independently and can complete their activities of daily living with ease. Everyone wants that phenomena, but it is not possible for every cerebral palsy individuals. Some individuals require interdependence. They will require some support and assistance. On the other side, few persons they cannot no longer live on their own safety. They require some support every times and ultimately crisis management. In the phase, they require skilled nursing facilities or receive extensive professional care at home. And in lastly, at the end of the life, the goal at this stage is for older adult to feel as comfortable as possible till the end. Aging can be the primary or secondary. The primary aging is changes brought about by the increasing age as a natural process. Secondary aging means the changes occur because of disease, disuse, abuse of our body as in cerebral palsy or in other diseases. In adult with cerebral palsy, both these factors work together. So aging effect apparent earlier than the expected in normal individuals. Now come to what is the normal aging? The normal aging process is associated with decline in cognitive or physical disability. As they age, they become older, they function well, but are at substantial risk for disease or increasing disabilities. Now, how we can achieve this successful aging? What is the definition of successful aging? Successful aging is defined as a high functional, physical, psychological, social functioning in old age without any major disease. That known as a successful aging. One book written by the John W. Rowe. It is very excellent book. Anyone can go with this book. You can find lots of information in this book. Component of successful aging. How you can achieve that one? With avoidance of disability and disease up to the maximum as much as possible. You should have high physical and cognitive functional capability. You should not sit at one place. We have to be very active. And active engagement in life by social participation and continuing productive work, paid or unpaid, it not matter. And adding high quality of life to year, not merely years to the life. So that we always say that we have to survive till the time where the quality of life is good, not just adding the year to the life. All of you will be knowing about the history of Hawking. He was developed motor neuron disease when he was early 20s, 18-20 year age. As you know that motor neuron disease person cannot survive after the 14 month of diagnosis. But he survived till the 76 year of the age. His IQ was excellent, 160. And motor neuron disease is much more severe than the cerebral palsy. His quality of life was good because he maintained everything what he want. So, determinant of successful aging, everyone should know. It depends upon lifelong choices, what are the diet you are taking, physical and mental health, self-esteem, exercise, yoga, physical, cultural, social environment, associated medical problem and intervention, and genetic makeup of the body. This was the fact. And now come to the how much cerebral palsy individual will survive. If they are independent walker, they will have a normal life expectancy. If they have only mild disability, no associated impairment, hemiplegic or diplegic, they will also have the normal age. But in the cases with severe responsibility, uncontrolled epilepsy, feeding difficulty, their age will be less than 30 year age. But if their problem is the moderate diplegia, quadriplegia, dystonic cerebral palsy, they can survive up to the late age of 60-70 years, slightly lesser than the normal individuals. What are the factors affecting the life expectancy of the individual with cerebral palsy? How much brain damage is there? What are the grade of severity? How much feeding difficulty have there? Seizure is controlled or uncontrolled? Cognitive function is bad or good? Respiratory, cardiovascular health and medical facility what for thereby at home. Early death in cerebral palsy occur mostly due to the respiratory 14 times risk is there and cardiovascular is only 3 times. Why old age so important in cerebral palsy? The aging process is going to affect everyone. But in cerebral palsy, aging may start earlier than the normal individuals because they have some other problems. Functional decline significantly as a result of aging. Problem in adult and older generation with cerebral palsy are going to much more worse than the normal individuals. They may need support and care as they ages. The adult with cerebral palsy can have lots of problems, just like the premature aging, post-impairment syndrome, musculoskeletal issues including degenerative osteoarthritis, osteoporosis, fracture, pain, functional issue at the workplaces, depression, cardiorespiratory function, sexual health, incontinence of the urine and toilets. Now we will talk each and every topic in subsequent webinar. The premature aging, the people with cerebral palsy are likely to experience premature aging around age of 40 years. Due to extra strain and stress on the body, cardiovascular and pulmonary system have to work hard. Degenerative changes in joint begin earlier, muscle become more tight, they become weakness, increase in energy expenditure will be there, chances of increase in imbalance that causes early fatigue. The symptom of premature aging is increasing in the pain, difficult walking, increasing in the stiffness in the muscle, increased risk of the fall, early fatigue, cardiovascular problem like hypertension, heart issues, asthma, respiratory problem, diabetes, obesity, osteoporosis, and long-term side effect can occur due to medication or surgeries. In the last, I wanted to say that adulthood can be difficult, exhausting process for anyone. As you know, in cerebral palsy, lots of other problems the individual can have, like spasticity, degenerative osteoarthritis, obesity. So they present some extra obstacle with early presentation. By maintaining a positive attitude, determination, dedication, exercise, yoga, lots of other factor, individual with cerebral palsy can enter the adulthood feeling excited for journey ahead and they also have good quality of life. We will talk lots of other topic in subsequent webinar and we will discuss everything in very finer manner so that every adult with cerebral palsy can live a happy and prosperous life. Thank you and wait for the next subsequent session on the Saturday at 7 p.m. We will talk how you can be happy and healthier life even with cerebral palsy. Thank you.